So friends, continuing our videos on X-rays for undergraduates, today we are going to discuss X-ray of the paranasal sinuses and the X-rays for neck, mainly for the foreign bodies. So we had discussed this in the last video also, that nowadays we have better modalities like CT scan and MRI, and especially for the paranasal sinus and nasal cavity pathologies, the gold standard is CT-PNS, because we can find out many detailed anatomical variations like the position of anterior artery, the level of skull base, and the pneumatization of middle turbinate or the paradoxical turbinate. So many different normal variations, anatomical variations are present in every individual, that if you are planning to take the patient for endoscopic sinus surgery, apart from your nasal endoscopy, you need a CT-PNS. But due to non-availability of CT scan at every center, radiology, that is X-ray PNS, still has a role in conventional rhinology. Now, what all do we see in X-ray PNS? We're going to discuss, but before that, what are the views for paranasal sinus and nasal cavity examination? The commonest one that we use is the Waters view, Pierce view, and Cardwell view. These are the common ones that we use. The difference is slight between the three of them. Between the Cardwell and the Waters view is of course the angulation. In the Cardwell's view, we can see the maxillary sinus quite well. We can also see the frontal sinus, but the ethmoid and sphenoid are not very clear. Whereas in the Waters view, we can see the ethmoids quite clearly, as well as we can see the maxilla very prominently. When we open the mouth of the patient as if he is drinking water, so we can see the sphenoid sinus in the gap between the two alveolus, the upper and the lower alveolus. So that is exactly where we will see the sphenoid sinus. So Waters and Pierce view is nothing but the same angulation, but with open mouth and closed mouth. Now let's quickly go and see how to read these X-rays. First of all, we are going to look into what is the normal anatomy. Let's take any one particular structure as an axis, and then start reading the X-ray first before jumping into the pathology. So let's identify. This is the orbit. We can see the orbit here. This is also the margin of the orbit. The side of the X-ray is of course marked that this is the right side of the face, this is the left. This is the frontal sinus scalloping that we can see. This is the nasal cavity proper with the septum in the center, and this is the maxillary sinus. This is the upper alveolus and the lower alveolus. These are the ethmoid air cells below the frontal. Now, remember that we are not going to read, okay, this is the X-ray of paranasal sinus which is showing sinusitis. We are going to take any one axis. Let's start with the maxilla first. So if we see the maxilla, let us first see the boundary, if all the walls of the maxilla are intact or not, and compare it with the other side. Then we can see the radiolucency in both the cavities with air column in the center. So air appears black. So wherever you can see air, it will appear black to us. Whereas soft tissue or inflammation, edema, these kind of things will appear hazy or radiolucent. And any solid mass, malignancy or bones will appear more radio-opaque or white. So the septum, the bones, the margins, the teeth or any solid mass will appear white in the X-ray. Now in this X-ray we can see that there is radiolucency in the maxillary sinus, but there is obviously no mass. We can see the air column. That means there is inflammation in the maxillary sinus, and this is very classically sinusitis. Of course, we don't know whether this is acute sinusitis or chronic sinusitis, because we don't know the history of the patient as to how long this patient is having these symptoms. But definitely there is sinusitis. One way how we can differentiate between acute and chronic is that if there is acute collection of the mucus or the pus in the maxillary sinus, then there will be fluid, and fluid will have concavity above it. If there is a polyp, it's a chronic condition, and there's a polyp in the maxillary sinus, then in that case there will be convexity in the maxillary sinus. All right. Then we can see the ethmoid and the frontal, which are absolutely normal in this case. Now we are going to discuss this case with another X-ray PNS, where you will see some difference in the view. Now in this X-ray, I think it is very obvious that we can see that there is a radio opaque mass in the right nasal cavity. Now once this X-ray is there and something is so obvious, don't jump in your viva to the pathology. You still start with this. This is the X-ray of paranasal sinuses, which is showing the maxillary sinus on the two sides, and it is showing the frontal sinus on the upper part, the nasal cavity with the nasal septum and the orbital margins, which are absolutely normal. But the right side nasal cavity and the maxillary sinus is showing a mass effect or some space occupying lesion, which is definitely not extending to the left side. The left side is showing a good air column. Therefore, this is a classical case of unilateral nasal mass. Now, this mass could be anything. It could be an intracorneal polyp. This could be fibrous dysplasia. It could be malignancy. It could be inverted papilloma. So we'll have to adjunct this with our nasal endoscopy findings. But this is a unilateral nasal mass involving the maxillary sinus and the same-sided nasal cavity. Thank you.